There are two main types of disc surgery. The first is the traditional method, where the entire disc is scraped out and removed to prevent it from coming back. This is what's known as conventional disc surgery. The second method keeps the disc in place so it can still act as a cushion, and only removes the fragments that are pressing on nearby nerves. These are the two main approaches. Personally, I think the traditional method should be avoided. That's because preserving the disc and keeping its cushion-like function is essential for the patient to return to normal life. Discs play a vital role. They act as shock absorbers between the vertebrae, preventing the bones from grinding against each other. Let me explain it this way. Think of a disc like a car tire. In the center of a tire, there's a tube, and around it, a thick layer of rubber. Similarly, when you look inside a disc, you'll find a soft nucleus at the center, surrounded by a tough outer ring called the annulus fibrosus. Just like a car tire, a disc is meant to provide cushioning. But what happens if that tire loses air? It collapses, and a car can't drive properly on a flat tire. The same goes for your spine. If the disc isn't intact, your vertebrae start to collide, nerves get pinched, and things stop working the way they should. The key to preserving the disc is laser treatment. So why is laser safe? It's incredibly precise, accurate enough to place a tiny dot between two fingerprints. Now take a look at a scalpel. It's huge in comparison. If you use a scalpel to cut the outer layer of the disc, you'll make a big hole. But with a laser, especially under a microscope, you can target the problem area with pinpoint precision. In fact, even when a laser is tested on human skin, it doesn't cause damage. It just leaves tiny round marks. The fingerprints remain completely untouched. That's how precise it is. So when it comes to treating disc problems without damaging the disc itself, laser is the key. When you cut into a disc, it looks like a round bun, and behind it is the Y-shaped lumbar bone. Between those bones is where your nerves run. On a CT scan, calcified discs show up bright white. Soft, bulging discs appear gray. If the disc is still soft, it can usually be treated with an endoscopic laser. This method usually heals well and causes little to no after effects. But if the disc has hardened and turned into bone, like the white lump you see in that scan, then microscopic laser surgery is the way to go. This method can precisely vaporize the hardened bone, almost like it's turning into smoke. In some cases, a diamond drill is used to carefully shave down the bone, just like peeling an eggshell. That's why microscopic laser treatment is often the better choice in these situations. There are many different types of disc surgery out there. But for those watching this video, I strongly recommend considering microscopic or endoscopic laser surgery. Methods that preserve your disc and help you recover without unnecessary damage. Thank you.